The management of immune-related adverse events, we call them irAEs, has changed a lot because they're unpredictable and they happen mostly when the patient is out of sight. So the real change has been educating that patient at the get-go. I actually have a separate visit scheduled with each patient starting immunotherapy with my nurse team and my physician assistant to go over the side effect management on a separate day than their visit to see me, so that they're fresh and they can really focus on something that is important, that might be a little bit boring but very, very critical. And that has been a big change for us because we never did that before. And then reminding them every time. We often see our patients every 2 or 3 weeks. They're doing great. Easy to forget that the side effect can happen even late in the treatment course, so that reinforcement is very important. That's new as well.
It's really important that we look at the whole cancer care team, because individually they each have a role to play when it comes to the management of the patient or the recognition that patients potentially are having an adverse reaction to the IO agent. In many cases, organizations have named someone a champion. One person who really takes on this as a priority, developing educational materials, providing in-services, making sure that at tumor board all the information is available when a patient who potentially is going to be receiving an IO therapy is discussed, but also helping to link the team with resources that are available in the community. One of the best practices related to education of IO therapies is putting together a list of specialists. So specialists that we would potentially refer to if the patient was having a side effect that needed managed by a specific discipline. In many cases, that could be an endocrinologist, a gastroenterologist. And again, bringing them in as part of the patient care team and having them educated as well. Why we're sending the patient there, the difference in this type of toxicity versus what we normally would refer, because it's not a traditional chemotherapy agent. And that's why it's so important that we educate our frontline physicians, especially those that work in the emergency department and primary care providers. We want to refer these patients for further follow-up and workup by potentially an endocrinologist, a gastroenterologist, but someone who's going to be helping us manage that immune-related reaction that the patient's exhibiting. It's a challenge for smaller organizations, certainly, because it'd be harder to have an IO champion when there's only less than 5 people potentially in a practice. And so that's really where the professional organizations have a significant role to play.